Do you think that as a society, as governments, we are limiting ourselves by not allowing for alternative medicines, particularly the use of psychedelic drugs like psilocybin or ayahuasca, in looking at treatment methods for people who have substance abuse issues?
So it's a good question, and in the book I have a chapter on psychedelics. These are not drugs; they're medicines, and they've been used traditionally in a whole lot of places, very successfully for a whole lot of reasons. What if I told you that there was a plant from which you take the extract, and you've been on heroin for 20 years, and if you do this extract under the safe conditions with the right guidance, with people who know what they're doing, and after 2 sessions or one, you have no withdrawal from the opiates. What if I told you there was such a substance? There is. It's an African plant called ibogaine.
Okay.
And it's sort of semi-legal in Canada, and it's completely illegal in the States. They're using it successfully in other countries. I've seen examples of people on heroin for decades who have been able to give it up with the help of this particular psychedelic. This psychedelic and others are also very useful in working through post-traumatic stress disorder and trauma of all kinds. I've worked with them for the last 13, 14 years. Studies are being done on a substance called MDMA, which in party terms is called ecstasy, but with proper psychotherapy in the right context, it's a very promising treatment for post-traumatic stress disorder, far more promising than any of the drugs that are employed in modern psychiatry. And so that governments are absolutely ignoring the evidence and some exciting possibilities when they're not facilitating and encouraging more research and more availability to such modalities. So it's just another area where, with a bit more open-mindedness, we could be doing so much more.